Hi, thanks for joining us. My name's Meg. I'm a career development consultant with the Careers and Employability Service, and the module we're about to do now is all on nursing interviews. So again, thanks for joining us. We are mostly focusing here on individual interviews, so that might be one-on-one or a panel, more the individual nursing student graduate turning up to be interviewed. Some organisations in South Australia and interstate do group interviews, but that we cover in another session, so look out for that module if you're likely to have a group interview. And of course we do have specialised resources for you, and we'll touch on those specifically as they relate to interviews. So this is one in our series of career management videos for nursing students, taking you through planning your career, job search, writing applications, and our focus today, which is on attending interviews. So we have our specialised toolkits for you on the Nursing Career Links resources page with specifically tailored content for first year, middle years and final year. So the final year covers your tips for attending interviews, including group interviews, practice questions, sample questions and other resources. Our early years pack has some quick tips for interviews with a focus on the carer roles. The middle years careers pack focuses more specifically on interview processes for assistant in nursing or AIN positions. We've also got another link there for you, which is in Health Times and all about nursing job interviews, and does also include some questions for graduate nurses. So plenty of resources to support our content today. So just touching on the fact that as we've seen with applications across the various modules we presented, the same applies for interviews. Different employers have different approaches across Australia. So to date, SA Health don't include interviews as part of their TPP, Transition to Professional Practice recruitment processes. Always check, of course, though, if anything changes year to year. Previously, Calvary and St Andrews hospitals have used group interviews with group exercises. So that's where we'd encourage you to attend our group interview session. Some interstate employers might offer telephone or Skype interviews. With the recent sort of COVID situation, we've seen some employers use video interviews. Others may offer group interviews as well. And if you're applying for any kind of general registered nurse or agency roles, you can also expect to be interviewed. Let's have a look at some of the different instructions that you might encounter. So these are 3 examples from 2019. In the first one, we see that they do both an individual interview and a small group interview. They were saying quite clearly that this particular employer wasn't looking at in-depth clinical scenario questions, and really wanting you to know that they were going to be trying to make that interview experience as fun, interactive and enjoyable as they could. I think that's a really nice point. They're not trying to trip you up in these interview processes. They want you to perform at your best. Here's another example in the middle. So being very clear that you had to bring along certain documentation, suggesting you come 15 minutes earlier, letting you know the panel was going to have 2 or 3 people, and that they were going to be very focused on selection criteria and the competencies. Okay, so just encouraging you to practice your techniques for interviews and try and relax. Other employers may well do medication tests. So this example here, there was going to be a medication calculation test, letting you know the interview was going to take about 30 minutes, that there'd be a small panel, and looking very much at competency standards and things like that. So sometimes you might encounter those sort of more clinical scenario questions or specific sort of skills testing approaches. Sometimes it's going to be a more straightforward interview. So check your instructions, check all the information that's given to you. At this stage, we'd also just like to highlight you have access to Big Interview. So we've given you the web link there. So this is a platform that you can use, a free platform for you to learn and practice your general interview skills. So this will give you a really good sort of background in honing the interview skills, and you can then relate that to the different sort of more nursing orientated approaches that you will encounter. There's 3 key stages to think about if you're going to have an interview. So there's things that happen before the interview that you need to be thinking about. Of course, there is the interview itself, and then there's a few things to think about post the interview. We've also just got a link there just in case you do encounter video interview formats, again, more in relation to current pandemic requirements. So before the interview, let's think about what you need to do. So it's a time to reflect. It's a time to be doing some research, to prepare yourself as much as you possibly can. So things to be aware of. How are you going to present yourself in relation to this particular opportunity? So you're wanting to really explore, what does this job look like? Really try to visualize what it looks like. What settings it in? What will you be doing? Who will you be talking to? Why does that attract you? Why do you want this job? What appeals to you about what you can see about the culture of this organisation? Also be aware what's in the mindset of the people who will be interviewing you. They want to know if you can do the job. Are you passionate about wanting to do this job in this setting? And will you fit the culture of the team, the ward, the hospital, the aged care home, the medical practice, whatever the setting might be? So 2 processes to think about. So do that reflection on why you, what you have to offer. We'll look at that in a moment. Why them? Really researching them. You can expect questions on why do you want to work for us? What do you know about us? Really knowing about the job. Learn as much as you can about the interview itself. What instructions can they give you? What do you need to bring? How long do you need to allow for the interview? Is there anything particular that you need to present? So even perhaps have some standard questions that you develop for yourself, just so if you do get that phone call to invite you to interview, or there's that opportunity to gently explore what might happen at interview, that you've got some areas that you want to address. Thinking about why you. So you're probably quite familiar with this diagram by now, but what are your strengths? What are your values? Preparing yourself, and this is where this diagram can be really, really useful, for the tell me about yourself questions. So you want to be very tailored in how you address a question of that kind and make it relevant to the employer, but also to introduce yourself in a holistic way. So you can make sure that you bring out your unique points of difference. What is your career story? So from what's led you into nursing, your key strengths you've demonstrated, achievements, what you've gained from all of your nursing related experiences, your placements, any sector related employment and volunteering. What you bring from any other employment experience, how have you drawn on that as a student nurse? Anything from extracurricular aspects of your life that make you who you are. So with that in mind, thoroughly review your application, revisit that, reread it, reread if it was a graduate recruitment handbook, if there was a position description, any documentation about the job, make sure you've really read that through. Review your placement reports and feedback as well. What again have been consistent things that are noted? What are highlights? Can you reference that in the interview? If they ask about teamwork skills, well, actually, when I reflect on my placement feedback, something that I've always been commended for is my blah, 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 and blah. Okay, so use it. We've talked about imagining yourself in the role. What will you be doing? When you think about what you might be doing, what examples stand out to you as being the most relevant ways you can match that? You can show that you could perform in that context. Really know what the role is, the scope of practice of the role. That can be really quite important if we're thinking about if you're going for a carer role, if you're going for an assistant in nursing role, or if you're going for the graduate role. So different sort of scopes and levels of practice. So be really attentive to that. Consider your STAR examples. We'll talk about that in a moment, but we also explore that in our application forms and selection criteria workshop. So have some really great examples about how you demonstrate the key skills and qualities they are looking for. And also knowing those transferable skills. So as we mentioned, perhaps, from other employment experiences, you may be able to bring further value to them. So situation, task, action, result stands for STAR. It's a way of telling a story. So here, rather than writing it in an application, you're meeting with the interviewers and you're relating these examples, or think of them as stories. You're sharing these experiences that are meaningful, that are really personal and direct from your experience, that relate to the criteria that they're asking about. So make sure the situation or the context is really clear to the panel. So which hospital, which aged care facility, which placement are we talking about? What is your role? What do you need to do in this situation? What do you do? The I language. Not what other people do, what do you do? The committee selection panel is looking to recruit you, not the team. So really talk through your approach. How are you thinking about this situation? Why do you choose the strategies that you're choosing? And then what is the result? What happens as a result? How have you shown your value and your positive impact through that STAR example? So one thing to do when you're preparing for interview is to really focus in, look at those key skill areas that they want, and really identify great examples about how you can show that. So we had a look at an example, STAR-based example, in our online application forms session. Here we got another example for you. This time we're looking at, tell us about a time when you demonstrated professionalism and effective time management skills. Now, if you get a question and it's in that framework of tell us about a time or give me an example of, it's what we call a behavioural question. By that, we mean they're asking you about a situation in your past where you demonstrated this target behaviour. And the idea is if you can share that example, that gives the panel an indication of what you can do in the future based on your past experience. So here, the situation is the person's a student nurse on placement at a particular aged care home. So the task that they had in this example, they are going to be taking the major responsibility for completing a medication round for 25 residents. The RN is going to be there as backup, but only if they need it. And also noting that many residents in this group have very complex health needs and medications. So we're starting to learn a little bit about the scope, the level, the magnitude for this example. So what actions does the student take? So think about your own actions. In this example, they've created their own running sheet, checked all the medications, checked medications they were less familiar with, made sure they knew where everything was stored, checked the medication charts and set up their trolley to make sure it was a smooth and efficient round. They touch on how they approach the residents, cheerful and professional approach, making sure that they're following the facility's policies, procedures and rights of medication administration. So you can sort of see it's a very holistic approach. What's the result? The rounds completed on time, required standards, residents have their care needs met and felt cared for. Good feedback from the RN who's supervising, and also a bit of a reflective comment there that they gained valuable experience in the role and responsibilities of the registered nurse in this setting within scope of practice, and then linking back to how this shows the professionalism initiative and time management. So you see here, these are star examples, and using this method ensures that you are going to give a very robust, very step and stage response to sharing those examples, sharing those stories. So really look at things that you are proud of, that you have a sense of achievement about, and this is the stuff of the everyday, if you like. Sometimes it might be absolutely exceptional circumstances that you face. Sometimes it might be more everyday aspects, but it's about choosing the examples you think that show you at your best. This was some notes and comments actually drawn from a conversation with SA Health, and this was in relation to assistant in nursing recruitment. So their advice, and I think it's probably pretty reasonable advice for any kind of nursing interview, was how have you shown these various capabilities? Where and what were you doing? So I think it also speaks to you need to be very specific, very clear about what context you're in. So key things they were looking at from the AIN perspective, again, you can see how this relates pretty well anywhere. Communication skills. Can you show that you're someone who is committed to person-centered care, builds rapport well? Obviously for the AIN role, they're looking for that experience in providing personal care, doing the ADLs. Also, a strong focus on ensuring safety. Think about these aspects when you're trying to identify your best star examples. That ability to work so effectively with culturally diverse situations. The clinical skills, dealing with complexity, responding to deterioration. Okay, so thinking about any experience you have with patients who have cognitive impairments, experiencing disorientation, or living with dementia. Can you work in a team? Do you understand documentation? And scope of practice, of course, is also something that's likely to be explored. So your understanding of what you can and cannot do in certain roles. We've talked a little bit about this. It's certainly something I think we've talked about a lot in all of our modules on the nursing career management skills, but really critical here is just making sure you have thoroughly researched that organisation. They will often ask those questions of what do you know about us, why are you interested in working with us, or it's material that you may well try and work into your responses to interview questions in some way. So research them, follow their news. If there's any opportunity to go to an information evening or event or online event, do so. If you did a placement there, really reflect on what you achieved on that placement and what you enjoyed about that particular setting, the environment, the culture, the staff that you worked with. This is also about professionalism 24/7. So when you're in that job search phase, when there are phone calls that might be coming in or you need to respond to emails really promptly, you are creating impressions at every point to employers, to recruiters. So make sure your social media is exactly as it should be, really professional. Respond promptly, respond professionally to any emails or voice messages. Let your referees know if there's an interview that's coming up or what's happening in terms of applications, stages, progression interview. So you want them primed and aware about what's going on, and making sure you have the appropriate attire as well for interviews. So it's really creating the best impressions at every point you possibly can. Now, preparing for interview questions. You can never really obviously predict every question that you're going to get, but you can have a look at what competencies and what qualities you know that they're looking for. So we're going to have a look at some sample questions. Here, we've got some of those standard opening questions. So they're really great opportunities where you can predict these sorts of questions. You kind of thought about them in advance and show how well prepared you are. So things like the tell me about yourself, what attracted you to this position, why are you interested in a career in this setting, why did you choose to study nursing, and one here that's more related to carer work, but what qualities do you have that will make you a successful carer? Okay, so again, you can see how that links back to that reflection and knowing yourself. About them. Why do you want to work for us? What do you know about this organisation or this sector? Or why would you like a graduate role in our particular hospital? Some of them can relate to, if you like, the organisation's mission or background knowledge. Who do you think our customers, clients, patients are? What do you think the service is? So make sure you do spend some time researching in depth who the employer is. We've talked a bit about the behavioural questions, so knowing if you get the wording such as tell us about a time when, or can you give us an example of. So here's a few that relate to nursing. What's one of your really good qualities? Can you give an example of a time when you've demonstrated this? Now, if you've done your research on the organisation, you may well pick, a quality you know that they're particularly interested in. Perhaps a time you worked effectively in a team on placement. So we want to know, what is that team? Which hospital is it? How do you prioritise tasks? Can you provide an example to demonstrate this? Sometimes the question might be posed as a situational question. What would you do if? So you're given a hypothetical. So if we have a look through these, some of them perhaps relate to carer roles, some of them relate to AIN, some of them you may well be responding to from a nursing perspective. So just be aware of what's the role, what's the scope of practice, what would you do? What would you do if a patient falls or a patient complains of chest pain? Or you have a resident living with dementia who's becoming increasingly aggressive. What would you do? How would you prioritise patient needs? You're given a bit of an example. Or for an assistant in nursing role, if a nurse came up and gave you a medication to give, would you give it? Do you know your scope of practice? So it's really useful to reflect on, have you actually encountered a patient falling or any of these sort of situations? So if you have, you could actually say, well, happy to sort of explore with you what I would do. In fact, I experienced this recently on Placement Act, and this is what I would do. Or if you haven't had that sort of experience, it might be, look, my understanding of what I would do would be to follow this procedure. And then step through what you would do. How would you think about solving that situation? Sometimes they could be clinical-based questions or knowledge-based, practice-based. They might be interested in exploring your understanding of work health and safety. It might be practical questions about what shifts are you able to do. So if that relates, make sure you've thought about that in advance. What does infection control mean? And again, we get another scope of practice example. So think about that in advance. You'll also see here in the slide notes, we've got a link to a YouTube video where there's actually a behavioural interview question in a nursing context, and you'll see them talk through their response. So that's something to have a look at in your own time, but it does illustrate many of the points that we have talked about today. A really good thing to do is to actually practice out loud. So your career packs across the 3 levels have lots of examples of interview questions. So just practice them. You might even record yourself or set up with some, trusted friend or family member and see if they can give you some feedback. Practice talking out loud. It's a different process looking at these sorts of examples and experiences and writing down answers, but actually speaking them out to a group of people. So you want to be engaging, you want to be confident in talking your way through these different examples. These are examples you've lived and experienced. So practice it out loud, get used to that process of talking out loud. Are you projecting confidence? Are you having hesitations on any particular questions? Are you too brief? Is it going on too long? Do you need to sort of make sure you've restructured it? Are you speaking clearly and not too quickly? So keep the rehearsal going. At the interview itself, do be aware. First impressions, try to manage those as you can. They will expect you to be a bit nervous, and you can see many of them talk about that philosophy about wanting to make sure that it's as fun and enjoyable as it can be. But just be aware that opening impression, think about your body language, your tone of voice. They're going to be the major things somebody's taking in a first impression. So remember to smile, and look as though you're really great, glad to be there. Aim to arrive punctually. So I think if we think back to the beginning of our module, one employer was saying, turn up 15 minutes before. Bear in mind you are on display from the moment you have walked in there. Be really courteous, really professional to absolutely everyone you encounter. Remember to turn off your mobile phone. You really don't want that going off in the interview. Just have part of you that's monitoring. Are you projecting a composed and professional persona? Are you making appropriate eye contact, smiling? Handshakes may or may not be happening at the moment due to COVID, so just respect whatever the protocols are. Hopefully you know the interviewers' names. If not, just make sure when you're introduced, sometimes they will tell you before the interview, but if you're not, as you're introduced to them, repeat their name. Nice to meet you, Joe. Nice to meet you, Mary. Lovely to meet you, Alex. That can help you remember the names. Do wait to be invited to your seat. Remember to keep an upright, but not bolt upright, but not too relaxed posture. Make sure you're not using distracting mannerisms. Remember, try to slow down. It can be very easy to speed up a little bit under those circumstances, but do try to do that. Just nice deep breathing, relax the shoulders, and you'll find too that you will relax as the interview gets up and running. Remember, you're there to tell stories, as it were, about great examples of times you've shown skills. You can enjoy that process of sharing. Make sure you've done those star examples in advance so they've got a good, clear beginning. You talk through your process, and then there's a clear finish. Highlight your enthusiasm. Always that walk between confidence and modesty, but I'd say just ensure you're providing those examples and evidence, and I think the enthusiasm then speaks for itself. Things to avoid: not being over familiar, so it's keeping that sort of professional manner, follow the cues that you're getting from the interview panel. So never be negative or criticise other people. Conversations about salary and condition, that can wait until the job offer. So try to focus questions around other aspects that are intrinsic to the role. We've got a few examples here because you may well find that you get the, do you have any questions for us? Sometimes it could be, do you have anything you'd like to add? So make sure your questions aren't already covered by the information that they have given you. So check any of that material. And as we've noted, save the questions on the benefits to you until you're at the job offer point. This is more about you showing enthusiasm and motivation for this particular role. And we've got a few different examples there. So showing that commitment to improving and developing yourself to have a great transition into the role. What are the qualities of their most successful graduates? That conversation around culture and values and genuine interest in that. Notable successes. Things that show that commitment and genuine interest in them. Sometimes anything you would like to add. So sometimes you might think, look, there's an example I would really like to share, or there's something I think I really want them to know that's going to add. So you may well bring that in. This is also a good opportunity just to reiterate your enthusiasm and desire to gain this role and to work with them. Strengthen the connection with the panel. It's also quite appropriate to, just have a checkout question as to what is the process from here, when might I expect you to hear on the outcome of this process. If you've got a lot of different interviews happening, it can be useful to have some idea as to when they might get back to you. But always remember, sometimes these timeframes can shift a little bit if they've got to chase referee reports and things like that. So don't worry too much if you haven't heard in that time frame. Sometimes it will just be a bit of a guideline. It'd be useful just to check out what the next steps and stages are. After the interview, evaluate your reflective practitioners. So review, what did you do well? And be really clear about that. Note that, it's a learning experience. Are there areas where you think you could develop your interview performance even further? Every interview is a learning experience. Make sure your referees are briefed. You might consider a thank you note to the interview if you feel that it's appropriate. And if you're not successful in that process, see if they're able to provide any feedback. Some organisations will, some don't, but it can be worth asking the question. A few tips from graduates. Know your own strengths and know areas of development. Never say weaknesses. And, if you're asked around that, try to choose something where you can actually put it a bit in the past, or you've identified that there was an area you like to develop and you can share what you're doing about it. And really good tip there, I think it really summarises everything that we've talked about. Prepare, 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 prepare. Know the employer, know your knowledge, know what you're interested in, be able to talk meaningfully about yourself in relation to this role. So do stay tuned to our careers newsletter to you every week. And we do have those opportunities for further conversation through group chat and Careers Over Coffee, which are of course currently online, and you'll find all of that information on Career Hub. So thank you so much for joining us today, and we do wish you all the very best for the interviews that may lie ahead for you. Thank you. Bye-bye.